CBT is a psychosocial intervention which focuses on changing unhelpful thoughts, beliefs, attitudes, behaviors, and it also improves emotional regulation and it creates coping strategies to solve problematic issues. Now look at the terminologies that we are making use of here, okay? So it is a psychosocial intervention first. What does that mean? Psycho, of course, means psychological aspects. Social means we are also working on the social aspects of the individual. So it will also include, how this individual is interacting with the environment. Environment, by environment, what I mean is other people, other relationships, maybe in their personal life, and professional life. So it includes social. So it is a psychosocial intervention. Then we focus on changing unhelpful thoughts. All right, so we have to be very, very particular about this word. What we are trying to change is only the unhelpful thoughts, beliefs, behaviors, in an attempt where there is a shift, a positive shift which comes over in their emotional state. And CBT is done with an intent where you should be helping your client to come up with their own set of coping strategies, right? So all we do is we facilitate the process. We don't really want to, give them the tools, but we want them to create their own coping strategies, as in whenever they are faced with any problematic situation, they themselves should be able to deal with it. So this is like the substratum of CBT, okay, this particular definition. This is how we move ahead with this particular therapy. So having said that, of course, we know that CBT, it is understanding our thoughts and how it works on your behavior. So there's a close connection between cognitions, that is thinking, thought processes, and two is behaviors. Now, something which is very, very, wonderful about CBT is it is a very short-term therapeutic intervention. The setup is such that the number of sessions are generally planned depending on the therapeutic goal. So it is a short-term therapy. It is also goal oriented. So in the very first session that you have with your client, you exactly have your agendas, you have your goals in its right place. So it is goal oriented. Also, the structure is in such a way that it is measurable. So it is an empirically proven technique because all the changes that we observe are also measurable. Okay. And as the name suggests, it's a combination of what? Behavioral and cognitive therapy. Now, what is very integral to behavioral theorists or the therapies which were being developed then was that behavior is something that can be trained, it can be changed. Okay, so this is what lies at the core of behavioral therapies, and that is something what even CBT has, borrowed from behavioral therapists. So it makes use of behavioral therapies as well as cognitive therapies. And of course, it's a very, very practical, to the point approach. So there is no beating behind the bush. It is very, very crisp, if I could say, very precise and to the point. And that is how the approach is very, very practical, right? So there's nothing very fancy about it, or you're not trying to get into the past. So it is to the point. That is how we look at CBT when we're talking about CBT.